Well, the Elon Musk hatred continues. Now he's getting blamed for supposedly killing millions of children with his DOGE cuts to foreign aid. This article by New York Times columnist Nicholas Kristof alleges that the cuts to USAID under the Trump administration with Elon Musk's involvement in DOGE have worsened the current Ebola outbreak in the Democratic Republic of Congo. Kristof has been a longtime advocate of foreign aid, and he argued that as the largest donor to the Congo's humanitarian work, the US left a vacuum there, allowing the virus to spread. Kristof also criticized Trump's decision to withdraw us from the World Health Organization and to target PEPFAR, the US government's global initiative to combat the HIV/AIDS epidemic. Overall, Kristof claims there were 750,000 excess deaths worldwide from our aid cuts between malaria, starvation, etc. This is Kristof last year.
Elon Musk had said that no one has died because of what he described as this pause to review aid. And, Harry, within an hour of beginning my reporting, I had found the names of two young children, a 10-year-old boy and an 8-year-old girl, who had died because their medication, their ARV medication against HIV had run out and they couldn't get new sources. These were orphans and vulnerable children. What is a 10-year-old orphan going to do in Juba, Sudan, when the caseworkers are no longer available and he can't get his ARVs? Turns out that he doesn't get medicine. His viral load increases. He gets an opportunistic pneumonia and he dies.
So Elon Musk responded recently saying they cannot cite a single name of someone who died out of the millions they falsely claim have died. Not a single name. Kristof took him up on that challenge and listed specific kids and adults who died, allegedly because they didn't have resources that the US ordinarily subsidized. Kristof wrote on Twitter, "Elon, I can give you many, many names of people who have died because of your aid cuts. Yama Freeman was a 23-year-old woman who died in childbirth because you stopped paying for the diesel for ambulances in her part of Liberia. I talked to her parents and sister in their village. Jabesi Gyadu, age 1, died of malaria because of your cuts in Liberia. I talked to his mom in her village. Ibrahim Karoma, an infant, died of AIDS in Sierra Leone after you interrupted HIV supplies. I talked to health workers who cared for him. Akal Deng was an 8-year-old girl with HIV in South Sudan who died when you cut funding for the healthcare worker who provided her medicines. I talked to him." I could go on. In almost every village you go to in South Sudan, Uganda, Liberia, Sierra Leone, or other countries I reported in, you find people dying because of aid cuts. I challenge you, come with me on a reporting trip and we'll talk to these moms and dads and you'll see the dying children themselves. I think if you see the kids whose lives are at stake, maybe you'll change your mind. This feels more like emotional blackmail dressed up as journalism. And Kristof is looking at this the wrong way, especially in a different way for most Americans. American taxpayers are not the world's parents, and you can't draw direct causation here with the deaths that he's alleging. Look at the actual long-term trend. Global child mortality has collapsed over decades. Vaccines, sanitation, nutrition, economic growth, and innovation did most of the heavy lifting there. Under 5 years of age, deaths worldwide dropped from 12.8 million in 1990 to 4.8 to 4.9 million in 2023 to 2024. That's a 60% plunge in that rate from 93 to 37 per 1,000 live births. And this happened while US aid levels varied wildly. The progress predates DOGE and continues in broad terms despite the cuts. South Sudan, Liberia, Sierra Leone, and parts of Uganda face conflict, corruption, and weak governance. Baseline child mortality was already tragically high there for reasons that have little to do with the US funding pause. PEPFAR, the HIV program, had real successes. Credit to the Bush-era effort that helped millions. But even successful programs create dependency when they're the default funding source for decades. So when Kristof gave this handful of tragic cases of kids dying in Africa, proving sole causation in chaotic environments is nearly impossible. DOGE and the Trump administration didn't zero out every vaccine or malaria net out of spite. They slashed 83% of USAID projects after reviewing for waste, fraud, abuse, and misalignment with American interests. We could fill an entire video just with the corruption of USAID. Established in 1961 under the Kennedy administration, USAID is meant to oversee humanitarian, development, and security programs, doing that in over 100 foreign countries. As originally conceived, the agency was meant to distribute aid in a way that advances U.S. interests, ideally without antagonizing the local population. But in 1994, whistleblower Paul Neifert revealed that the agency was distributing U.S. aid based on race in violation of federal law. Senior USAID officials in South Africa allegedly violated procurement laws for U.S. assistance to the country by implementing a race-based spoils system. Now, this scheme required its staff allegedly to give USAID funding on a racialized basis to USAID's favorite recipients, both in the US and South Africa. Flash forward. USAID awarded a US-based research organization called Eco Health Alliance, that may ring a bell. They gave them millions of dollars in grants, which ended up helping to fund risky bat coronavirus research at a little lab in Wuhan, China. Research that is now widely believed to be responsible for the COVID-19 pandemic. And USAID funneled at least $122 million in grants to terrorism-tied aid charities, including an evangelical Christian group that in 2014 facilitated a $125,000 sub-grant to a Sudanese terrorist organization linked to Al-Qaeda's Osama bin Laden. USAID gave grants to Hamas-tied groups, including one that was delivered just days before the October 7th terror attack on Israel. So USAID had become a very unethical slush fund, to say the least, for billions to be funneled through some problematic NGOs and foreign governments with high overhead costs, including ideological side projects like DEI consultants, gender programming, climate activism. That's why it was an easy target for Elon Musk. Foreign aid overall is tiny, roughly 1% or less of the total US federal budget. International affairs spending is not the backbone of global child survival. American private charity alone dwarfs much of what government aid achieves in targeted, voluntary ways. And here's the fundamental mistake in Christoph's worldview. He treats American taxpayers as an infinite ATM for global humanitarianism. The US government exists to serve American citizens first: secure borders, strong economy, rule of law, infrastructure, veterans, and domestic safety nets. It is not a global parent or charity enforced at gunpoint via taxes. Sovereign countries have primary responsibility for their own people. Many African nations are resource-rich with young populations. What chronically holds them back is often government failures, corruption, bad economic policies, and conflict, not insufficient US checks. Also, couldn't we apply Christoph's logic to Christoph himself? He's quite successful. He's a 2-time Pulitzer Prize-winning columnist for the New York Times, co-author of several best-selling books. He's had decades of book royalties and speaking engagements. No doubt his network has pretty high net worth too. Why doesn't he start shaming all his rich buddies and benefactors to donate more to the cause? Had Christoph funded more medical research, maybe the people in question would not have died. Probably because this isn't about saving lives, it's about perpetuating the NGO complex with lots of cushy salaries paid by the taxpayer, but unaccountable to the taxpayer. It's dishonest to blame Elon Musk for the deaths of people in Liberia or anywhere else as a result of demanding accountability for how we spend the tax dollars of hardworking Americans. Why does America have to pay for diesel for ambulances in Liberia? And if the US stopped paying, why didn't the local authorities find another way to pay for those essential services for their citizens, rather than just stop the ambulances? If people individually wish to give, that is their choice. But our nation is $40 trillion in debt. We are not obligated to fund every clinic, every medicine abroad while our own debt explodes. Veterans wait for care, cities struggle with crime and homelessness, and working families face high costs right now. True compassion means honesty about what works. Self-reliance, good governance, private initiative and innovation, not perpetual extraction from American workers to subsidize foreign systems that often fail to fix root problems. Christoph sees suffering and demands more US checks. The better response is to build a stronger, more efficient America that leads by example and capability, not by guilt-funded dependency. That's not heartless. That's responsible and reasonable. Hey, thanks for watching. Make sure you leave your thoughts in the comments below and hit that subscribe button so we can keep the party going. I'm Caroline Downey of National Review, signing off.